So whenever patients have acute pancreatitis, sometimes patients tell me that their family members don't understand the pancreas, haven't heard of the pancreas, tell them perhaps that they were drinking a lot as the cause of their pancreatitis. And so, Tina, how do you explain this diagnosis of acute pancreatitis to your family and your friends?
Nobody heard of it, same as me. And so I was out of town, and so, nobody knew what it was. I didn't know what it was. I had to move in with my parents, and they learned at the same time I did about what was, to do and, all that. So, and then of course, you have some people in the family, saying that it's, drinking or whatnot. But my mother probably took it the worst because she was scared, real scared.
Okay. Anybody else want to take?
When I was first diagnosed, it was very difficult for me at first to explain what it was with my family because I didn't fully understand it. But then after having relapses of the pancreatitis and learning more about it with, Dr. Gordon, who I first started seeing, and then when I met Dr. Gardner, I started to learn a little bit more about it. So it became a little bit easier to explain it to my family because at first people were diagnosed with pancreatitis were alcoholics or they had gallstone issues, and neither of those applied to me. Nobody in my family has ever had pancreatitis, even though I have people in my family that were chronic alcoholics. Nobody has ever had it, so it was really hard to explain. And my family members who were alcoholics were like, "Well, I don't have it. Why are they saying you have it when you don't drink?" And so it was really difficult to just even explain that to them. And finally, after my final diagnosis of what it was causing it, people started to really then fully understand, well, it's not because you're an alcoholic, it's not because you have gallstones, it's because you had this, and so they now learn, and they actually went on the internet and looked it up, and they realized that it's an organ that people don't really want to mess with. So, yeah.
Steve, can I put you on the spot here? How do you explain your pancreatic disease to your family and friends?
How did I initially?
Yeah.
I didn't. I didn't know what the pancreas was. I don't even think I knew how to spell it. I was alone when I had an acute attack, and I toughed it out for about 12 hours. And then I drove myself to the hospital where a CAT scan revealed that it was pancreatitis. I, in all honesty, still didn't take it too seriously. They told me they were going to keep me a couple days, give me fluids, I wouldn't eat. I was like, great, I really want to get out of here. And 3 days later, I left and thought I had walked away from the whole experience, actually. And I had a follow-up visit with my family physician, and he said, we don't know what caused this, and it's gone away, and you're going to be fine. Don't worry about what you eat, go about your life. So it wasn't until I realized that I was really sick that I dealt with understanding it myself, and with my family needing to understand it. So I wasn't quick on this. I wanted to pretend it wasn't happening.